Hello, everyone. My name is Dr. Ashwin Mehta, and I'm the Medical Director for Integrative Health, as well as Physician Wellness here at the Memorial Health System. And I'm very happy to bring to you these resources that are of tremendous collaboration between Memorial Health and Fitness, our Human Resources Department with Organizational Development, Physician Wellness, as well as our Integrative Medicine program, have all come together to provide these wellness and resilience resources for you. And so thank you all for participating in this wellness and resilience virtual panel. Please do keep a lookout for communication regarding additional content in the future. But we are delighted to be joined by both Dr. Kumar and Rob Herzog. So Dr. Kumar, would you like to say a few words about who you are and what you do?
Sure. I'm Dr. Sameet Kumar. I'm a psychologist at the Memorial Cancer Institute. I've been with Memorial for about 10 years now, and I'm happy to be part of this wellness and resilience initiative that we're taking to really address all the unprecedented challenges that we're facing, not just at Memorial, but globally, and really getting all the tools that we know of that can be helpful to help cure this pandemic and all the challenges and changes in our lives that it's brought.
Fantastic. And we are delighted to be joined by our health and fitness expert. Rob Herzog is the Director of Fitness and Sports Medicine for the Memorial Healthcare System, and he has over 30 years of experience as a clinical exercise physiologist. Rob, we're so delighted that you're able to participate today and lend some wisdom regarding your vast experience as it pertains to health and fitness especially.
Well, thank you for having me. I appreciate it.
So, Rob, I can tell you that, from a personal standpoint, my exercise and fitness routine has been tremendously disrupted. But could just, from your vantage point, could you share with us a little bit from a fitness standpoint, what impact has this disruption had on our routine? What impact has that had on our overall health?
Well, there's no doubt that this is something none of us have faced, and so this disruption is very significant. People like routine, and they do what they enjoy to do, and they do well. So some of those things have gone away in the last few weeks, of course, and so for some, if they're not looking at alternatives, then that means they're doing nothing, and they're probably sitting and watching more Netflix movies or something. Instead of getting those exercise minutes in every day. And so for them, it's a real situation where their physical health will start to decline a bit, especially the conditioning that they've developed over the years. And that can happen relatively quickly. So it's very, very important that they think of alternatives here. And they need to do some things to keep their body moving for many, many reasons.
Yeah, I know as a psychologist, we are frequently encouraging people to develop routines, and really wellness routines are the cornerstone of modern psychotherapy and wellness, especially for our cancer patients or anybody who's into medical diagnosis. And you guys in physical therapy and rehabilitation have been instrumental in that. Can you describe how exercise can impact our stress and really our anxiety and our mental health? I know it does for me, but I think it's something very important for our audience to appreciate also.
Yeah, and often people don't realize those benefits. They're exercising for other reasons, but it's well documented that exercise can be very, very effective in helping deal with their stressful. It's a great release. It's a great time if you're exercising where you can, think about things and get your mind on other things, as well as just physically, what it's doing there as far as helping release that stress and physically making them stronger, more resilient. If done regularly, it's very, very effective, and there's enough literature showing that.
Yeah, there was this really interesting study that was put out a couple of years back about how exercise in combination with mindfulness meditation practices can actually help address depression.
Absolutely. And the other thing that's a recent article that came out just showing how effective exercise is with our immunity system. And, as you know, stress can play havoc on that, exercise can combat that. So, it's a balance for many, many things. Exercise can play a role in many, many things.
I frequently think of oxygen as the most widely abundant mood-altering substance on the planet.
It's a great way to put it.
I like that. Excellent.
And we're also detoxifying, right? Whenever we're breaking a sweat, all of those, the skin is really an eliminative organ, right? So anytime we're breaking a sweat, we're also really detoxifying, reoxygenating, increasing our core body temperature, which enhances immunity. So a lot of tremendous physiologic benefits to exercise. So Rob, if there are others out there who, like myself, have been kind of using the chaos of this pandemic to make excuses and become largely more sedentary. I've certainly noticed, significant changes in my body composition, loss of muscle tone, and sort of a physical deconditioning setting in. What steps can we take to restart a fitness routine and kind of reinvigorate our approach to exercise and fitness at home?
Well, I think number one thing is you have to keep an open mind, and that, yes, your routine has been disrupted, but there are other things you can do that are very effective, and they can get you through this. And I think we do have some folks that will just stop because they can't do what they normally do, what they're good at doing. So it's very, very important to look at other options. And there are so many other options that you can do in your home, or if you're in your neighborhood, going out walking, trying that. If you're not a walker, you're a runner, you can run. But if you're someone who gets on a treadmill, for instance, in the gym, get outside and start doing the walking. I see more people doing that. If you're someone that cycles a little bit in the gym, well, if you have a bicycle at home, get out and start training with that and exercising with that effectively. Very, very important. You got to change your routine a little bit. Now, from a fitness professional standpoint, we encourage that even within our gyms. Cross-training, you'll often hear that term. We want to encourage people to change things because, yes, you may be proficient in one area, but your body actually thrives on change and kind of shocking what you're doing, shocking your system a little bit, challenging yourself a little bit. That actually has many, many health benefits, physical benefits for strength, flexibility, endurance. So in some ways, this is an opportunity to start taking on new things, trying new things that you have to do within confined spaces or in your own neighborhood, but it can be done. And this is really important to think that way and break off from your normal routine. Otherwise, the alternatives do nothing, and we know that that's just not going to be helpful at all.
Yeah. In just a few minutes that we have left, is there something that you can recommend for people to do who may be quarantining in a confined space or not have a whole lot of space to move around in, or who are worried about going outside and walking among other people who may not be respecting social distancing?
Yeah, for me, that usually means, because you have a lack of exercise equipment, it's body weight type exercise, using the walls, using a door, those kind of things. You can do things like wall squats, you can do lunges, you can use your furniture actually to help hold on, to assist, to do things like squatting and lunging for your lower body. For your upper body, you can do normal calisthenics. You can use hopefully some things in the kitchen that you have that have a little bit of weight, and actually simulate some of the things that you would do on a machine in the gym or with free weights. Now, it may not be the same weight, but just add more repetitions. Rest a little less in between sets. There's ways you can manipulate to get a good exercise routine and keep the body moving. Number one, just keep the body moving, keep those joints loose. Stretch a little bit more. You can stretch more times throughout the day, of course, instead of the one time you normally would do it. Keep moving, especially if you find yourself at home, working from home, sitting behind a desk. You got to get up and move. You can do that at home. But there's no question about it. Body weight type exercises would be your most effective.
You guys are talking about something really important. For example, working from home, and when our routine is disrupted, we may actually spend more time than usual, or more time than we realize, sedentary. So one thing that I've tried to incorporate is just setting a timer for every 90 minutes, getting up, walking around, stretching a little bit. Just kind of periodically having that punctuation mark during the day is so important. I find that we're good at what we like, and we like what we're good at. So if physical fitness was compartmentalized into three different categories, one being cardiovascular and aerobic endurance, the other being resistance training and strength, and last being flexibility and balance. I've always find myself really gravitate towards the resistance training and the flexibility and balance with a yoga practice, but I haven't been so good with the cardio. So sometimes, identifying areas where we have not really been so good in the past, and using this as an opportunity to get after those areas of fitness in which we may have been a little bit deficient. I find myself doing more cardio now just because it's more accessible than some of those other things that I've been doing in the past that require, a structured gym environment.
And it's really important that you have balance in your physical exercise routine. You should have balance. Imbalances often cause injury. If you emphasize one over the other for a significant amount of time, you're not necessarily, you're hindering development in the other areas, but also you can overuse and have overuse injuries in the other. So we see that a lot in an athletic population where they're practicing their sport and they basically condition themselves to do these certain movements, but they could have weakness or inflexibility in other areas. And that can sometimes later on cause some real problems for them. So obviously we're not talking about professional athletes here, but people fall into that as well, where they get these imbalances because they favor a certain exercise, just like it, feel better when they do it, perform very well doing it, but they get these imbalances, and later on that can catch up to you with injuries. So this is an opportunity to look at your balance, and the three components that you mentioned, cardiovascular, strength, and flexibility, they should all be emphasized right now. They can be done at home. They can be done in a short period of time. Other than cardio, you may want to spend more time with cardio. And it can be done more than one time a day. Compare it to when you go to the gym only once a day. If you're working from home, you could break that up into 3 times a day if you like, and do it in a very short period of time and get the benefit.
So these quick hits throughout the day are really useful to incorporate into our routines. I like that. That's a great idea.
Yeah. Mm-hmm.
I can certainly relate to the imbalance component. Go ahead.
I was going to say, I'm frequently telling my patients the importance of physical activity and just building up your physical strength and reserves, using those 3 domains. Our emotional health and well-being is dependent on those physical reserves we have also. So I kind of think of the physical reserve as being interdependent with the emotional reserves. We're really just treating the mind and the body together.
Absolutely.
And Rob, really appreciate all the resources that you and your team have made available, everything from the yoga video that you've posted and, so many of those other healthy tips and tricks that you've shared, through Memorial Health and Fitness. Really enjoying those videos, and they're really kind of helping me keep going. So thank you for that so much.
Oh, you're welcome. We plan to keep those coming.
Awesome. Thank you.
Great. Thank you guys so much for your insights and, for sharing your tremendous amount of experience and wisdom that is so helpful during these challenging times. Little tips and tricks to keep us going, to help us manage stress and cope with the anxiety and the uncertainty, as well as the physical deconditioning that can often set in. So thank you so much, Rob, for being with us, and really looking forward to all those other videos that you're going to be posting through the Wholesome Me intranet resource. And please do, everybody, look out for additional resources that we're going to be putting together. Next week is going to be our Dietary Divas. We're going to have some nutrition experts come together with some recipes to keep things fresh and convenient and healthy, as well as tasty at home. So thank you all for participating, and please do keep the feedback going via email